मेरा नाम लवनीत कौर है। आज हम कैंसर के ऊपर बात करेंगे। हमारे साथ मौजूद हैं डॉक्टर पीके रायना, जो कि राज हॉस्पिटल में कैंसर स्पेशलिस्ट हैं। सर, प्लीज इंट्रोड्यूस योरसेल्फ।
मैं डॉक्टर रैना हूँ। मैं कैंसर सर्जन हूँ राज हॉस्पिटल में। पिछले 8 साल से मैं राज हॉस्पिटल में कैंसर सर्विसेज में अपना दे रहा हूँ। हम लोग यहाँ पर कैंसर सर्जरी, कीमोथेरेपी, रेडियोथेरेपी सारी सुविधा सारे मरीजों में कैंसर के ट्रीटमेंट करते हैं। और कैंसर के जब हम आज का हमारा ये टॉपिक का एम, हमारा पर्पस ये है कि जब भी किसी लोगों को पता चलता है उन्हें कैंसर है, तो हाफ ऑफ द टाइम लोगों को होता है कि वो काफ़ी ज़्यादा परेशान हो जाते हैं, इतना कि उनको ये नहीं समझ में आता कि हमें करना क्या है, हमें क्या जानना है। उनके लिए लगता है दिस इज द एंड, कि अब ये सारा खत्म हो गया। लेकिन आज के डेट पे ऐसा नहीं है। कैंसर का प्रॉपर ट्रीटमेंट है। आपके शहरों में भी हो सकता है, लोग बाहर जाकर ट्रीटमेंट कराते हैं, उसकी ज़रूरत नहीं होती है, इतनी सुविधा है। प्रॉब्लम है अवेयरनेस कम, के लोगों को पता नहीं होता कि हमें क्या करना है, क्या जानना है। तो हमारा आज का वेबिनार का एम हमारा ये है कि जिन लोगों को भी कोई कंफ्यूजन, कोई क्वेश्चन है कि भाई कैंसर का हमारा कारण क्या है, कैसे इलाज करना है, कैसे आगे बढ़ना है, कैसे ट्रीटमेंट कराना है, कब कब ट्रीटमेंट करना है, कैसे फाइनेंशियल कॉस्ट होंगे, ये समझने के लिए हमारा एम है। नवनीत, मैं चाहूंगा कि आप अगर कोई क्वेश्चन है तो आप उससे शुरू कर सकती हैं।
Yes, sure, sir. So, sir, first question is, what is cancer? The most common type of cancer found in human.
कैंसर एक इलनेस है, बीमारी है, जिसमें कि जो बॉडी के सेल्स होते हैं डिफरेंट पार्ट ऑफ द बॉडी में, हर एक बॉडी में अलग अलग डिफरेंट सेल्स हैं। हमारे मुंह के अंदर, लंग्स के अंदर, लिवर के अंदर, ब्लड के अंदर, बोन मैरो के अंदर, अगर वो सेल्स अनएक्सपेक्टेडली बढ़ने लगे और वो खत्म ना हो तो कैंसर है। कैंसर में एक्सेसिव प्रोडक्शन ऑफ सेल्स इन सिंपल नॉर्मल लेट टर्म। अब अगर वो ट्यूमर हमारे ओरल कैविटी में बनेगा तो मुंह का कैंसर हो गया, ब्रेन के अंदर बनेगा तो ब्रेन ट्यूमर हो गया, लंग्स के अंदर होगा तो लंग कैंसर हो गया। इस तरह से डिफरेंट डिपेंडिंग ऑन द ऑर्गन, किस ऑर्गन के ट्यूमर कहाँ पे बढ़ रहे हैं उसके हिसाब से कैंसर होता है। अगर हम दूसरी बात करें कि कॉमनेस्ट कैंसर क्या है, तो सबसे कॉमनेस्ट कैंसर इंडिया में फीमेल में ब्रेस्ट कैंसर है, ओवेरियन कैंसर है, सर्वाइकल कैंसर है, फिर ओवेरियन कैंसर है। मेल पर्सन में कॉमनेस्ट कैंसर अभी भी लंग कैंसर एंड ओरल कैंसर है, और ये दोनों कैंसर टोबैको रिलेटेड है, तंबाकू से रिलेटेड है। सो कॉमनेस्ट कैंसर स्टिल मेल में लंग कैंसर एंड ओरल कैंसर।
Yes, sir. So, next question is, what is the main cause of cancer? And in general, at what age the cancer is commonly found?
See, मोस्ट ऑफ द टाइम कैंसर देयर इज नो डेफिनेटिव काउज, कोई स्पेशल कोई कारण नहीं है जिसकी इस कारण की वजह से कैंसर होता है। ऑलमोस्ट इन 30% ऑफ केसेस कैंसर इज ड्यू टू टोबैको एंड टोबैको रिलेटेड प्रोडक्ट। तंबाकू और उनकी तंबाकू, खैनी, पान मसाला, गुटखा, सुरती, इन सब की वजह से बहुत सारे कैंसर होते हैं, जैसे मुंह के सारे कैंसर, लैरिंजियल कैंसर, ओरोफेरिंजियल कैंसर, लंग कैंसर, इसके। और ये ऑलमोस्ट 30% ऑफ द टोटल कैंसर बर्डन वॉल्यूम है। तो अब अगर हम इस कैंसर को के मेन कारण की बात करें तो तंबाकू एक ऐसा कारण है जो कि प्रिवेंटेबल है, जो हमारे अंडर डायरेक्ट कंट्रोल में है, जिसको कि प्रिवेंट कर सकते हैं। इसके अलावा कुछ वायरस हैं जो कैंसर कॉज करते हैं, लेकिन मोर मेजोरिटी ऑफ टाइम देयर इज नो डेफिनेटिव काउज कि ये एक कारण है जिसकी वजह से ये कैंसर हुआ। 70% केसेस में ऐसा नहीं हो पाता है। Yes.
Next question is, can stress cause cancer?
There is no data or any studies which proves that stress can directly cause cancer. Yes, stress will increase your suffering of the treatment and the disease by cancer, but it doesn't cause directly cancer.
Okay, sir. Which is the deadliest cancer found?
There is nothing like deadliest cancer. By mean, whenever people listen that there's cancer, half the time people think that it's the end. It's not like deadliest. Still, most of the cancer are treatable and few of them are curable. So I won't use this term at all. So yes, Not all the patient get cured. But there is no, you can't quantify that this cancer can't be treated. Almost all the cancer there is treatment in earlier stage, but in later stage, majority of the cancer can cause death. So there is nothing called deadliest. That is the most deadly is the unawareness. If you have tumor in early stage, most of the time it can be treated and curable also.
Okay, sir. Next question is cancer also caused by genetic factors? Are other members of our family at risk?
Few of the cancers are the genetic or familial. Those who run from one family to another. There are few cancers like breast and ovarian syndrome, where if a mother has a breast cancer, the daughters and granddaughters have increased chances of cancer in the breast and ovarian. Few colorectal cancer and familial, but majority of cancer are still somatic, means de novo. They appears because of the changes in the genetic changes in the individual body. They may not, most of the time, they're not familial or genetic. In for to develop a cancer, there has to be some changes in the genetic level, but in the individual situation, not, and these may not be transformed in the generation and to generation. So only few cancers is familial. That means which goes from one generation to another, and that percentage is quite low.
What are the some symptoms of cancer and how can we prevent or manage them?
See, symptoms depend, as I explained you earlier, कि हमारा ट्यूमर जहाँ बॉडी में जहाँ होगा उसके अकॉर्डिंग ट्रीटमेंट होगा. Someone has a tumor in the brain, then he has symptoms related to the brain. If a tumor in the oral cavity, then he will some have wound या someone non-healing ulcer और एक घाव होगा अंदर जहाँ से जो कि ठीक नहीं हो रहा होगा वो बढ़ेगा. If a lady has a breast cancer, she will feel a lump in the breast or in bleeding somewhere. तो ये कैंसर के जो सिम्टम है दैट विल डिपेंड अपॉन कि हमारा डिजीज कहाँ से स्टार्ट हुआ है, बॉडी के किस पार्ट में है और बॉडी के कौन कौन क्या क्या ऑर्गन को इन्वॉल्व कर रहा है. अब एक ट्यूमर इन द गॉलब्लैडर ऑब्स्ट्रक्टिंग द बाइल डक्ट, तो वो जॉन्डिस भी हो सकता है, कभी कभी फीवर भी हो सकता है. लेकिन मेजॉरिटी ऑफ केसेस में अगर लंप है हमारा कहीं पर जो और कोई घाव है जो कि हील नहीं कर रहा है, कहीं से ब्लीडिंग हो रही है, तो दीज आर कॉमन सिम्टम फॉर cancer.
So, sir, next question is what should we do if we notice new symptoms or if existing symptoms worsen?
Repeat your question, Phil. Please repeat your
What
question.
what should we do if notice new symptoms or if existing symptoms worsen?
See, suppose if someone is having some symptoms like lump or anything which is related, which when anyone is suspecting that it may be a cancer, you must consult a doctor. He will properly take history and examine you. If required, get some tests done. Because if it is, may not be all the symptoms related lump are cancerous, but that has to be proven, has to be proved first. What is the what is which type of cancer is there? Only then can they proceed. So whenever there is symptoms, you must consult a doctor, not necessarily an oncologist, your family physician or a doctor, depending upon your symptoms, and then they will guide you properly.
The next question is in general, what are the diagnostic tests or procedures are being done and how often?
See, diagnostic test purpose is to prove it and to know the staging. Because whenever we have a symptom or sign that suspicion of cancer, we have to first prove it. Prove it by confirmation, either doing by biopsy or FNAC from the organ which is involved, or we do multiple scans, CT scan, MRI, or PET scan as required in the individual cases, not necessary to all the cases. But for the diagnosis, the best way is to confirm it by FNAC or biopsy.
What is the stage in cancer? What does this mean?
A stage means how much it has progressed. Suppose whenever there is a diagnosis, we tell the patient that this is this cancer. Suppose someone has a oral cancer, uh, then we tell them what is the stage. Stage means how much disease has progressed in the body. In the simple term, there are 4 stages of the cancer. Stage 1 is early stage, when the tumor is localized to that particular organ where it is starting. Suppose a tumor is starting in the tongue, it is localized the tongue, less small in the size. But if that same tumor increases in the size, then most of the time it becomes stage 2, but at the same organ, same level. Like starting in the breast, then it is localized in the breast, or in the liver, localized in the liver. But if it is go to from that organ to regional area, suppose a tumor in the oral cavity goes into the lung, or in the goes into the cervical lymph nodes, loco-regional area is stage 3. Stage 4 means tumor has gone from spread from one organ to another organ. If a disease from the breast has gone to the lung or liver, then become a stage 4. So there are no fifth stage. Stage 4 has simple one meaning. That means that is not the end of the disease. This has gone from one organ to another. And in most of the time, stage 4 it's so difficult to get cured, but still there is treatment. So by stage means this is early stage 1 and 2 we count as the earliest stage. Stage 3 and 4 we count as well locally advanced or metastatic disease in stage 4.
What are the chances of recovery from cancer?
Vice President, please repeat.
What are the chances of recovery from cancer?
Yeah, recovery, it all depends on the stage and type of the tumor. If it is early stage, most of the time it is curable. But in the advanced stage, it's all depend the different outcomes. So you can't quantify for each and general public that this is curable, this is not curable. For individual person, we decide depending upon the type of the tumor and the stage of the tumor and varying other factors, that is this is curable, what other person. So most of the time, in simple language, if I explain, in early stage, it is curable. The the more the stage increases, chances of survival decrease.
The next question is, what are the treatment options for cancer, and which type of treatments or combinations of treatments is recommended?
See, in cancer treatment is mostly 3 ways: surgery, chemotherapy, and radiotherapy. And majority of the time 2 or 3 modality or all the 3 modalities are required. For a solid organ tumor like in the oral cavity, breast, lung, surgery is the best way, where we can, if you're able to remove the diseased part of the tumor with adequate margin, that is the surgery. Aim of the surgery is to remove complete tumor. For the surgery is one modality. Chemotherapy, where we give drugs through intravenous route or per oral. There are many of the time oral tablets also for different cancers, which is different type of chemotherapy like biological therapy or immunotherapy. And another third option is radiotherapy, where we give externally radiation, is high dose radiation is given in 3-dimensional confrontal model to particular affected area to kill the cancerous cells. So treatment modality is mainly surgery, chemotherapy, and radiotherapy, and most of the time it is combined and used judiciously depending upon the patient type of the tumor, stage of the tumor. Maybe sometimes radiotherapy can be first, followed by surgery or chemotherapy, or either way, surgery followed by radiotherapy. It has to be decided by the oncologist, and they decides and start the treatment according to them. So it is completely individualized. If it is all the 3 modalities been used, it can be differently used with different persons. Next, any question? I can take question from Facebook. Dr. Ravis has a question. What is the current scenario in GI malignancy incidence? Yes, Dr. Ravis, thank you for joining us. The current GI malignancy incidence, if you see in the India wise, the primary is the colorectal cancer, followed by gastric and G junction tumor. The colorectal stomach gastric cancer is decreasing trend. Colorectal and G junction cancer is usually increasing in the trend. And the colorectal, usually we are finding with two peaks in the one is the younger age group, other in the younger age means 15 to 20, 25-year age group, and then in the 45, 50 years age group. So still, gastric malignancy has a little declining trend, but majority of colonic malignancy that stands in the fourth or fifth cancer, colonic and gastric malignancy in India.
अभिषेक भट्टाचार्य जी.
Yes, Dr. Abhishek has a question, sir. In oral cancer, second primary hai is a recurrence. How will you differentiate? So, suppose someone has oral cancer which has been treated by surgery and chemoradiotherapy. The most of the time, the same recurrence happen around the primary excision area. Suppose we have excision in the oral cavity in the buccal mucosa and RMT. So recurrence in the same zone is mostly recurrent malignancy. Second primary can happen, but it will happen usually a certain period of time where the patient is completely asymptomatic, disease free, and if it still continues with precipitating factor like tobacco or any other tobacco in any form, he can develop second primary in the different area also. Particularly because of the long standing use of tobacco, whole of the mucosa and alveolus process they get slow get changes in the mucosal changes. But one area developed changes in rapidly that will develop in cancer, and what we have already treated. But if it continue, if we see continue with the tobacco, the another area of the body can still develop cancer. So mostly differentiate the primary tumor usually happen in the same surgical site area. Second malignancy can happen in a different area. Suppose even after 2 years a malignancy happen in the same regional area, so what will you qualify as a second primary or a recurrence? But mostly we'll take it as a recurrent tumor in the same surgical field if it is there. Yes, Dr. Abhishek, another question is what about the prognosis second primary? It is still depend upon the first primary, but if it is recurrent, always chances of cure or survival it is decreased. But again, it depends if it is treatable or not, or complete excision or complete treatment is possible or not. If it is possible, again after even recurrence, that can be treated. Obviously, plus prognosis is definitely poor from the if it is recurrent tumor. And if it is the second primary tumor, suppose after a certain period of asymptomatic period, it develops second primary, again it can be curable. It can be, you have to treat this as a complete curative aim. If it is complete excisable, it can be curable if it is arterial resection is achieved.
Okay, sir. Next question is cancer completely treatable?
Yes, the answer is neither yes or neither no. Yes, treatable is yes. Curable, not yes for every time. So almost all the cancer, there is treatment for this. Treatment, whenever we diagnose a cancer, we decide the aim of the treatment most of the time. It is the aim is to cure it or to disease control or just a palliative treatment. So when early stage, most of the time we decide for curative aim. Even in the local regional disease, locally advanced disease, we still aim to cure it. But the chances of recurrence in that case is a little higher. Still, a patient can develop recurrence after a certain period of time, months or years. But when it is metastatic, when we are not able to cure it, we keep our aim is disease control and we treat it accordingly.
Okay, sir.
Thank you.
What type of cancers have the lowest survival rate?
There are survival rate. There few cancer have very poor survival, like pancreatic and gallbladder malignancy in this part of the country. Both we are saying usually there are very few 5 year survival for particularly gallbladder cancer and pancreatic cancer.
Okay, okay, sir. How will this treatment affect our daily life? Will the patient be able to work, exercise, and perform usual activities?
Most of the time, yes, because the most of the time treatment duration is longer and all the treatment is little exhaustive, like surgery or frequent chemotherapy. So most of the we recommend to patient to complete do his whatever his job is there to continue with the job, light physical activity, because the treatment is usually 6 months to 8 months to almost a year many times. So he can't be keeping idle at home. So we'll continue his routine activity. Yes, there will be some restriction, no, not a very high physical activity, but they can continue his job depending upon the if it is light job, and they must do his physical work because the aim of the treatment is to cure, not to make him bedridden or sick because of the treatment. So our aim, most time we explain patient to do his job, whatever the routine activities do, and follow the doctor's advice of the treatment.
Okay. Is there any side effect of the treatment?
Yes, in oncology, most of the time people are afraid of the side effects of the treatment. Whatever treatment we do, surgery, obviously there will be a scar. Most time we will remove the part of the body also along with the part of the tumor and the area. So there will be some defects. Suppose if we have a tumor in the oral cavity, we'll remove the jawbone or tongue. There will be difficulty in his speech or swallowing. But most of the time we guide them to overcome with this loss of the whatever the organ part of the organ is lost. To body most of the time changes itself. We have to learn the suppose advanced oral cancer we have done the surgery, then people have to learn to eat and swallow properly so that there won't be any loss in the weight, so they can maintain their nutrition and they can do their work. So this is the side effect of surgery. Similarly, chemotherapy, yes, chemotherapy causes many side effects like bone marrow suppression, leading to neutropenia, fever, decreased body immunity, weight loss, anorexia, vomiting. These are common side effects. Sometimes constipation or low motion. These are common side effects happens in different gravity, severity in different persons. But majority of time, this side effect can be overcome by simple medication. Very few percentage of the people they have severe side effect. But for that, we need intervention accordingly. But majority of time, by simple medication, we can control these side effects. One side effect I want to mention specifically about the hair loss. This is very common question we used to get in our OPD or explaining when we are doing counseling for chemotherapy of the females for breast or ovarian cancer. Yes, this happen, but this is just temporary. This is not permanent hair loss. After the completion of treatment, people used to get the same density of hair as it is earlier, but it will take some time to grow hair. But this is for my side, it's a small, not is so much significant um, side effect, so that we can change the treatment. But the treatment side effects of there are side effects of radiotherapy also, of like particularly in oral cavity dryness, little darkening of the skin. But majority of time, these side effects are temporary, and it will overcome after the completion of the treatment. Thank you.
Thank you, sir. Could the treatment of cancer affect the ability of a female to become pregnant or have a children?
Yes, because most of time our chemotherapy drugs they suppress the fertility also. So it decreases chances of fertility, but still after treatment also female can have fertility, and we do advise in younger girls or female to preserve ova and for further fertility. So we for this I will advise to have female to discuss with your doctor if you want to continue the family after that fertility. Discuss with the doctor; they will guide you properly. What precaution, what further procedure is required for this. But yes, fertility can be preserved in majority of time.
So my next question is how we are managing the side effects that the patient experience during treatment.
Just I explained you earlier. The majority of the side effects are like nausea, vomiting, loose motion, constipation. There are different simple medication person has to follow for few days, and it is well controlled most of the time. Whenever it is increased, we have to consult your doctor. There are medication for this way to control these side effects. So majority of side effects of chemotherapy or surgery, we can handle it with medication, simple medications.
So sir, last question is what is the chance that the cancer will come back? Should we need to watch for specific signs or symptoms?
Yes, this is very important question. In fact, those who are undergoing treatment are those who have completed their treatment for cancer. They must ask their doctors for follow up how to what to observe. It depends upon the site. Suppose a person having oral cancer, there are always, if he avoid tobacco, then he has to see that if there is any ulcer or any wound redeveloping in that area. Similarly, if I have a breast cancer lady post treatment, they must do self breast examination or any pain anywhere in the body, you happen to consult your doctor. So, depending upon the primary tumor, which is the primary tumor, the chances of recurrence, doctor will explain the primary the patient to so that they must know what are the things to look after for follow up that there is recurrence or not. And one more thing, very important, I want to say to any of the patients or to doctors to explain their patient that they must be in regular follow up with their doctor because there is always a chance of recurrence. The aim of this follow up that we catch him early and treat him accordingly. So they must follow up and discuss with your doctor what are the chances, what are the because this chances of recurrence depends upon the type of the tumor and stage of. Accordingly, doctor will explain you, the treating doctor will explain you, and they will guide you properly. But this is not about the fear. This is about the knowledge of the symptoms and signs so that you can detect it and take consultation as early as possible. Thank you,
Okay,
Lavanya.
thank you, Dr. P.K. Raina, for giving us great knowledge about cancer. Okay, thank you.
Thank you, Lavanya.